Yes.
Hi, Mrs. Bauman. My name's Marcelle, and I am your nurse today. Is now a good time for me to do an assessment?
Yes.
Okay, let me just close this curtain for privacy.
Okay.
Okay, so now that the curtain is closed for privacy, I am going to perform hand hygiene. And I am doing that because I closed the curtain. Who knows what's on that curtain? So when I touch my patient, I want my hands to be clean. So while I'm doing that, Mrs. Bellman, can you tell me your full name? Your name, Mrs. Stella Bellman.
Stella Bellman.
Okay, Stella, and can you tell me your birthday? You can be yours.
12361.
All right, and do you have any allergies?
And not that I am aware of.
Okay, wonderful. Thank you. So the first thing that I'm going to do is I'm going to dim the lights.
Okay.
For the purposes of the video, I'm not, so you can see what I'm doing. What we're going to do first is I'm going to shine a bright light into your eyes to make sure that your pupils react to the change in the light.
Okay.
So ready?
Mm-hmm.
Okay. Nice. And now this side. Okay, they do. Now I want you to follow my pen
Okay.
as I move it in towards your nose with your eyes. Okay, very nice. And then we'll just do a little H here. Okay, good. So her pupils are equal, round, reactive, and accommodating to light. And while I'm here with my pen light, can you just open your mouth for me so I can look inside? Okay, I don't see any dental caries, and her mouth looks pink and moist, no broken skin. Thank you, Mrs. Bellman. All right, so now we've established that she is alert and oriented to her name and her birth date. Do you know where you are right now?
Yes, I'm in the hospital.
Okay, and do you know what today is?
Yes.
What is it?
It's August 25th.
That's pretty good. So she's probably more alert than I am because I did not know it was the 25th. So we're going to say alert and oriented times 4. All right, so next I'm going to look at your skin on your arms and make sure you don't have any injuries to your arms or bruising or any abnormalities that I would need to be aware of. And her skin looks good. So while I'm assessing those arms, I am not just looking at if there's any abnormalities or wounds. I'm feeling for the temperature of her skin, and I want to make sure that it's not too warm, it's not too cold, it's not clammy, or she's not diaphoretic, and she's not, so all of that would be a normal finding. And next I'm going to pinch here to see if she has good skin turgor. That tells me if she's dehydrated or not. And so I'm looking for less than 3 seconds from the time I pinch it till it returns, and that's good. On an older person, sometimes it's best to use up here on the wall of the chest because the skin's already kind of loose and it doesn't react how you want it to. So next I am going to look at your pulses. So I'm going to be feeling your pulses. And the pulses are a +2 and equal bilaterally. Okay, and the last thing I'm going to look at when I'm looking at your arms is I'm looking at capillary refill. And I'm looking to make sure that when I push on those fingernails, the color changes and it goes back to pink or red within 3 seconds. And it does. And I would do the same thing on her toes. And when I do the toes, if she has polish on, you don't have to do the nail bed. You can just do the tips of the fingers or on the top of the toe. So if they have nail polish, you can work around that. Okay, so Mrs. Bellman, next I would like to listen to your heart.
Okay.
So I'm going to just ask you to not talk while I listen, just breathe normally. So I'm first going to identify S2, which is in the second intercostal space on the external right border. Okay? Okay, and then the last thing I need to do is I need to listen right underneath that breast. So can I have you just lift that up for me a bit, and then I will listen. So this is midclavicular line, 4th or 5th intercostal space. Sometimes you have to move the stethoscope around to find it because everybody's is a little different. So this is both S1, and it is also the apical pulse. I want to listen to the apical pulse for a full 60 seconds, and I'm listening for regularity, and I'm counting her pulse from here. So I have listened for a full minute, and at that point I would say that your pulse rate was 82 and it was regular. Next I want to listen to your lungs. So I'm still with the no talking. Do you have any questions so far?
Not yet.
Okay. And I need to listen to you in the front and the back because you can hear so much better from the back. So I'm going to raise your bed up just a bit to save my back.
Okay.
Let's see. Okay. And in the real world, I would take her gown and move it, but for the purposes of the video, I am going to just do it over her shirt, but you definitely want to do it under the gown if you want to hear the actual sounds. So this is bronchovesicular, bronchovesicular, vesicular. Take a deep breath every time I put this there, just in through your mouth. Vesicular. Sorry, I'm going to lift that. Vesicular, vesicular, side, side. And now I'll raise you up a bit, and I'm going to have you sit all the way up. Thank you, Mrs. Bellman. Bronchovesicular, bronchovesicular, vesicular, 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 vesicular. Okay, thank you. So, Mrs. Bellman's lung sounds, you may go ahead and relax, are clear in all fields, both anteriorly and posteriorly. So we've done your lung sounds, and I just want to add that when you're listening to the lung sounds, you don't want to go below the rib cage line because that's no longer the lungs. So let's now move to your stomach area. In the real world, I would ask her to raise her gown, and I would first assess and just look at it, not touching, and see if I see anything abnormal. Do I see any lumps or bumps? Do I see scars, tattoos, piercings? And I'm going to note that in the chart. So Mrs. Bellman, I've listened to, or I've assessed your abdomen, and now I'm going to listen.
Okay.
So I'm just listening for gurgling in your belly. So we're going to start in the right lower quadrant and go in a clockwise direction. So right upper quadrant, left upper quadrant, left lower quadrant. And you want to go in that order when you're listening. And I heard bowel sounds in every area. So I would say that they were normoactive. If you don't hear anything, you need to listen for a full 5 minutes in each quadrant, which seems like a long time. But you can't say there's no bowel sounds or they're absent until you've done that. And sometimes they're like crazy gurgly. That's hyperactive. But hers were normoactive, which is what I will be charting. After you have assessed and listened or auscultated, now you want to palpate. So I'm going to just push on your belly. You tell me if you feel any pain. And I am looking for pain. I am looking for any abnormal lumps and bumps. And I don't feel anything. Did you feel any pain?
No.
All right. So my abdominal assessment is normal, within normal limits. And then the last thing that you want to make sure of when you're assessing the gastrointestinal system, we've asked Mrs. Bellman about her bowel habits, and now I want to ask her, do you have any issues when you are urinating, like any burning or pain?
No.
Frequency, like you can barely get to the bathroom?
No.
Okay. You don't notice when you lean over, like sometimes you have to pee more and you thought you were done?
No.
Okay. Very good. Then I would say that I'm not finding anything abnormal in the GI-GU system. Now we're going to move on to your grips, pushes, and pulls.
Okay.
So what I would like for you to do is squeeze my hands as hard as you can. Okay. So her grips are equal and strong bilaterally. And we've already assessed those pulses, pushes and pulls. So push, and now pull against me. Okay, so those are also strong and equal bilaterally. Okay, so we've done that. Now I'm going to start moving down towards the foot of the bed. So you might want to grab those glasses. I'm going to take your blanket off for a moment. And in the real world, at the hospital, she wouldn't have shoes on, but I let her keep her shoes on. So we're going to pretend she has no shoes on. I would remove socks if they were on the feet, which they should be for safety. And so I would be looking at her skin on her legs, okay? I might at this point ask her to roll over and assess the bony prominence of this sacral area, because when you're in bed, if you have thin skin, that's the first place it's going to break down. While she's there, I'm looking at the back of her elbows, another bony prominence, and that skin is normal and intact, no redness. You're welcome to roll back over. Okay, Mrs. Bellman, I'm just going to lift up your foot so I can look at the bottom of your heels.
Okay.
And what I'm looking for is, again, this is a bony area, and it's on the bed. I'm making sure that that skin looks good and there's no redness and no pain when I'm pushing on that area. And obviously her socks are off while I'm doing this, and those look good. And now I'm going to assess those pedal pulses. Sometimes those are kind of hard to feel. If the person has edema, they might be hard to palpate. Or if they're older and they don't have great circulation, you might have to use a Doppler. But in this case, Mrs. Bellman is pretty healthy and she has strong and equal pulses in the pedal pulses, a +2. Now I want you to push on my hands as hard as you can. Good, and now pull back. Good. So her grips, pushes, and pulls are good. I'm going to look for edema in both legs. I'm pressing. She does not have any edema or swelling. And her skin looks good. There's no skin breakdown, no scabs, no bruising. That's a good time to look and say, have you had any recent falls if you see something like that? Thank you, Mrs. Bellman. I appreciate you taking time with me today.
Thank you.
And I'm going to leave you, because I'm done with that assessment. I want to make sure you have this call light. You know how to use it?
Yes, I do.
Okay,
Thank
and we're
you.
going to put your bed back down all the way to the floor,
Okay.
because you know why? I don't want you to fall. And I don't want you to get up on your own. So if you need to get up, just push that call light and I'll come back and assist you. Are you comfortable? Do you want the blanket
Can
back
I
on?
get the blanket back up?
You sure can. It is a little chilly in here. Do you need anything else?
Nope, I think that's it.
All right.
Thank you.
I will be planning on rounding in about an hour, but if you need me before then, just push your call light and I'll be right in.
All right, thank you.
All right. Thank you.